Hi everyone, this is Glenda Ganzon and welcome back to my channel. For today's video, I'm going to discuss the part 3 of health education, hygiene and sanitation, particularly on the determinants of health. So stay tuned. I'll be starting my discussion with these two questions. What makes some people healthy and the others unhealthy? And the other one is, how can we create a society in which everyone has a chance to live a long, healthy life? The answer to that will depend on the determinants of health. And these are the factors that contribute to a person's current state of health. These factors may be biological, socioeconomic, physiological, psychological, behavioral, or social in nature. Scientists generally recognize 5 determinants of health of population, and these determinants of health fall under several broad categories. The first one among these is the policy making. Policies of the government affect individual and population health. Increasing taxes, tobacco sales, for example, can improve a population's health, reducing a number of people using tobacco products. Some policies affect the entire population over extended periods of time while simultaneously helping to change people or the populations or the individual's behavior. Example, the Highway Safety Act and the National Traffic and Motor Vehicle Safety Act that set and regulate standards for motor vehicles and highways. If you remember before, there is no lane here in our places or in some of the places all over the Philippines for motorcycle, for tricycle, and for bikers. But lately, just on the onset of the pandemic, the government has set a policy and has set a lane for those bikers, for those who are using tricycles or motorcycles. That is one of the Safety Act or the Highway Safety Act. And this led to an increase in safety standards for cars, including seat belts, which in turn reduce rates of injuries and deaths from motor vehicle accidents. Most of us here in the Philippines, this is just based from my observation that most of the people who are riding in a car don't use seat belts. And that's very dangerous because we don't know what may happen. So we should always wear our seatbelts whenever we are riding in a car. Another factor is the social factor. Social determinants of health reflect the social factors and the physical conditions of the environment in which people are born, live, learn, play, work, and age. Also known as social and physical determinants of health, they impact a wide range of health, functioning, and quality of life. Example of social determinants include the availability of resources to meet daily needs such as educational and job opportunities, also the living wages or the healthful foods. We also have the social norms and attitudes such as discrimination. Another is the exposure to crime, violence, and social disorder such as the presence of trash. Another is the social support and social interaction, the exposure to mass media and emerging technologies such as the internet or cell phones. Another is the socioeconomic conditions such as concentrated poverty, the quality of schools, transportation options, the public safety, residential segregation. Example of physical determinants include the natural environment such as plants, weather, climate change, the built environment such as buildings or transportations, the work sites also, the schools and the recreational settings. Another are the housing, homes and the neighborhoods, also the exposure to toxic substance and other physical hazards, the physical barriers, especially for people with disabilities, the aesthetic elements such as good lighting, trees, or benches. And poor health outcomes are often made worse by the interaction between individuals and their social and physical environment. For example, millions of people in our country live in places that have unhealthy levels of ozone or other air pollutants. In countries where ozone pollution is high, there's often a higher prevalence of asthma in both adults and children. Poor quality can worsen asthma symptoms, especially in children. Another also is the health services. Both access to health services and the quality of health services can impact the health. For example, lack of access or limited access to health services greatly impacts an individual's health status. For example, when an individual does not have health insurance, like for example, PhilHealth, they are less likely to participate in preventive care and they are more likely to delay medical treatment. There are some barriers to accessing health services and they include the lack of availability of health services, the hospitals near their places or health center near their places. Another is the high cost of professional fee or the hospital fee in which most of the people cannot afford, especially those who doesn't have health insurance or PhilHealth. Another is the lack of insurance coverage, just like what I've told you earlier. And these barriers to accessing health services can lead to, of course, unmet health needs, delays in receiving appropriate care, inability to get preventive services, and, of course, hospitalization that could have been prevented. The fourth determinant of health is the individual behavior. Individual behavior also plays a role in health outcomes. For example, if an individual quits smoking, his or her risk of developing heart disease is greatly reduced, of course. Many public health and healthcare interventions focus on changing individual behavior such as substance abuse, diet, physical activity, and positive changes in individual behavior can reduce the rates of chronic disease in this country. Example of individual behavior determinants of health include, of course, number one is the diet. Another also is the physical activity, especially this time of pandemic, everyone is in the house. So we need to exercise once in a while or every day. And of course, alcohol, cigarette, and other drug use and hand washing. This is very important nowadays, hand washing, because we can prevent a lot of diseases through hand washing. And the last one is biology and genetics. Some biological and genetic factors affect specific population more than others. For example, older adults are biologically prone to being in poorer health than adolescents due to the physical and cognitive effect of aging. Like for example, the sickle cell anemia is very common. Like for example, this is an example of genetic determinant of health. So sickle cell is a condition of people inherit with both parents carry the genes for sickle cell. Example of biological and genetic social determinants of health include first, the age, of course. Those the older generation or the older people and the younger people are more susceptible of infecting diseases, or because of their low immune system. Another is the sex. It is believed that female are more prone to diseases than men, and some believe that men are prone to some diseases or accidents than women. And of course, the HIV status, because people with positive HIV status are more prone to some diseases because of their compromised immune system. Another is the inherited conditions such as, just like what I've told you earlier, the sickle cell anemia. Another is the hemophilia and cystic fibrosis. People carrying the BRCA1 and the BRCA2 gene, which increases the risk for breast cancer and ovarian cancer for female. Let's say, for example, your aunt or your mother has cancer, so it will be more likely for you also in the near future to have cancer. And of course, the family history of heart diseases. So this is it for the part 3 of health education, hygiene and sanitation. I will be discussing hygiene in my next video. So thank you again for watching the third part of health education, hygiene and sanitation. Please, if you haven't subscribed yet to my channel, subscribe now. And if you like this video, please give it a thumbs up and share this video. And of course, please click the notification bell so that you'll be updated with my new videos. Until the next one, bye everyone, and thanks for watching.